For several weeks, the medical industry has been waiting for a judge in Texas to hand down a ruling concerning the constitutionality of the Affordable Care Act's mandate that health insurance providers cover preventative health care. And just this week, the judge did hand down his ruling. And while he did uphold some of the preventative care requirements that the ACA includes, some of them he struck down as being unconstitutional. Specifically, one of those preventative care measures that he did not uphold is for HIV preventative drugs. And the reason behind that is that the group that made that part of the ACA requirements was not a group that was allowed to make laws. So that is why that was ruled unconstitutional. So now health insurance companies, they have been thinking probably for the past month or so that they may need to start considering whether they will continue to cover preventative care depending on how the judge ruled. And now that he has ruled to eliminate that requirement for some preventative care, not just the HIV preventative drug, but also certain cancer screenings and alcohol abuse counseling. So insurance companies are going to have to decide, are they going to continue covering that at 100%, or is that going to become like all other healthcare, subject to a deductible, a max out of pocket, co-pays, things like that. Just because it's not required doesn't mean that it has to be dropped as 100% coverage. The health insurance companies can choose to continue. And each company will have to weigh the benefits versus the cost of covering preventative care at 100%. If you think about cancer, somebody might go for an annual exam and their doctor recommends some preventative cancer screening and they say, all right, I might as well do it. It's not going to cost me anything. And then they find out that they have stage 1 cancer, very early stages. Treatment is simple. The insurance company does not have to pay very much for their treatment because the cancer had not spread. Now compare that to somebody where that coverage is not, where preventative care is not covered at 100%. And their doctor may recommend a test and they might say, I just don't think I'm at risk for that. I don't want to pay for it, so I'm going to skip it. And then a couple years later, when they're feeling symptoms from the cancer, they go and have the test done, which reveals they have stage 4 cancer, and now they need intensive treatment, chemo, radiation, surgery, extended hospital stays, and the insurance company is going to have to fork over a lot of money to pay for those claims. So it may be in the provider's best interest to cover preventative health care, just like it was mandated. And then one final consideration is that this Texas ruling may just apply to the company that brought this lawsuit. And it may not become a general update in the law across everywhere. That's yet to be seen. But in the past, when certain contraceptive preventative drugs were deemed unconstitutional to be mandated, that companies provide those for their employees, that ended up not just being the company that brought it, that ended up being across the board to companies across the U.S. that health insurance providers do not have to cover those. Companies do not have to provide coverage for those if it goes against their religious beliefs. So it is likely that this will affect everyone, but it's not for certain. So we'll have to wait and see. And in the meantime, insurance companies, it's time to start evaluating the benefits and the costs of continued preventative care coverage at 100%.